Good afternoon. This is Brian G. Just here to give you an update here in Fremont County. As you know, the current number of positives in Fremont County is 17. Recently, the Wyoming Department of Health webpage has added some good statistics and images to display the demographics of the patients known to be positive in the county. As you are likely observing, the numbers across the state are rising on a daily basis. Though the new webpage at the state is informative, I would add that this is likely not a complete representation of the number of potentially COVID infected patients, nor does it let us understand if there are any seriously ill patients with this disease. This is potentially problematic because it does not truly express what is going on in our community and our state. As many of you know, I have worked as a physician in Lander for almost 20 years. The majority of which was spent in the Lander ER. I was chief of staff at Sage West Lander for 4 years. Many of my friends in this community are physicians and other healthcare providers. I can only speak for Fremont County and what I've been told by these individuals who are on the front line in our clinics and hospitals who are caring for people in the community. I can say that this virus is causing people young and old to be ill, some of whom are moderately or seriously ill, requiring hospitalization. We have tried to get a better handle on the numbers currently going on in the county. And as many of you know, testing has been problematic. It has been limited and there has been delays. One thing that we've been trying to do over the last week, and this has been helpful and actually becoming even more standardized, is trying to get numbers from all of the clinics in the hospital in the county to see if we can better able to assess the disease incidence within our communities. As of this morning, those numbers would be put at approximately 200 to 300 people in the county that have presented to providers with cough, fever, and upper respiratory symptoms suggestive of COVID-19. This data, along with the fact that influenza testing has shown a decrease in influenza, would suggest that the primary virus in our communities right now is this COVID virus, and we are acting accordingly. We have instructed all the providers when they are evaluating patients to instruct them on self-isolation techniques and to give them numbers so that they could call back into county health so that we could talk to them more in detail about self-isolation and social distancing techniques. On a brighter note, we are now considering some potential discharge of patients from the hospital. As you may or may not be aware, the average hospitalization time frame is about 10 to 11 days for COVID-19 patients. This can present some real logistic challenges for the hospitals taking care of these patients. Public health is working in conjunction with the hospital to try to see how best to manage these patients, coming up with staffing contingencies and potential other facility considerations. That's been a big part of what we've been doing this last week or so, not only trying to find out the incidence of the disease within our community, but also trying to figure out what might be our future plans to help take care of these patients as they move from hospitalization through that hospitalization and then back into the community. As you all are pretty well aware, most people with this illness will not have a severe illness, and that's wonderful. The difficulty is in not having a severe illness, it's easy for us to feel like we aren't sick or maybe only minimally sick. And that has been the reason behind many of the social distancing measures that have been taken by the governor. And many of you may be aware that some of these might be extended here into the future further to try to prevent the spread of the disease by social distancing measures. So in closing, I say we should heed the governor's request to continue good self-distancing and social isolation. This is an important way for us to try to minimize the spread of the disease. It is a difficult time for all of us. We appreciate that in the healthcare field. We understand people that are having trouble with their businesses, how to manage children at home, and how best that we can as a community work together to help mitigate the spread of the disease. Not only are we trying to prevent our older adults and people at higher risk from getting ill, we also would like to keep the hospitals open as best possible for those of us that might suffer from other medical illnesses like heart attacks or have to require an emergency surgery. This does not just affect the COVID patient, but this affects all of us in a community and all of our healthcare providers as well. So with that, I'd maybe open it up to some questions if there are some out there on the line.
Yeah, Brian, can you hear me?
I can. Is this Chris?
This is Chris with the Casper Star Tribune. I have a question about the 200 number you threw out just a few minutes ago. Now, are those, patients that have now have tested negative for other illnesses like flu and are, presumed to have COVID-19?
That's a great question, Chris. I can't tell you if all those patients have been tested negative for the flu.
Okay.
For the past couple of weeks, that had been the priority. If you can, test somebody, especially in the hospital setting or emergency room setting, they were wanting people to test for the flu because influenza was still in the system, so to speak. Many of these patients that would count in that number would be people that present to the clinics with these symptoms of cough, subjective fever, and upper respiratory symptoms.
Okay.
So I can't guarantee that all those were tested or not for the flu.
I have a couple of quick follow-ups, then I'll let someone else hop on.
Excellent.
Have those 200 all been tested then for COVID-19 or not?
No, not at all. Actually, as you know, the testing throughout the state has been limited and quite delayed. We were seeing delays here, especially through private corporations like LabCorp, up to anywhere from 5 to 10 days, depending on the volume of the testing. So the testing has been very difficult for everybody, probably around the nation. And so these numbers we felt would be a marker of what might be the disease incidence in our community. And so we've been asking the community clinical providers and the hospital to provide us with these numbers on a day-to-day basis. And from yesterday going forward, we hopefully will have a more accurate estimate on a day-to-day basis to see if we can try to estimate what's going on in our community that way.
And then this is the last one that I'll hang up. Are all 200 of these, are they somehow connected, if you're able to say, to the Showboat facility outbreak, or are you able to say anything in that regard?
I don't believe they're all connected to the Showboat.
Okay. Thank you.
Next question.
Hey, yeah, this is Katie Rennick with the Ranger newspaper. How are you?
I'm well, Katie. Yourself?
Oh, I'm doing all right. I've got a little cold. Who knows?
Okay.
Maybe some COVID.
Yeah.
I was wondering, of the confirmed cases, can you say any more about what parts of the county those people are from?
The bulk of our confirmed cases have been, from the Showboat Retirement Center. There has been an association with that cohort in the Fort Washakie region as well. There is one case from Riverton that is unclear based on contact tracing done by the state so far, whether or not that's connected or not.
Just want to remind people, oh, go ahead.
Nope, all you.
I was just going to say, just reminding people that a couple of radio stations are airing this live, so hopefully you don't want something out there as a question. Yeah. But one of the questions I had was some people, this is John from 88.1 Rustler Radio, some people have kind of speculated that possibly this has come through here before late January, that this has already been through here with people saying they've already had the illness of their life and everything like that. How do you address that? And would it make a difference even if that were the case?
Thanks, John. That's difficult to assess. It's a potentiality, I guess, but there's no way to really know if that was the case or not, based on our current testing in that. So.
Sorry, I had muted myself. I had meant to ask, is everyone in the Lander Hospital or is there a patient in Riverton?
That's true. I believe everybody's currently in the Lander Hospital.
Bill, if you have a question, can you unmute yourself? You're still muted.
Okay,
Okay.
sorry, I guess I'll pass for now.
Oh, you're on now, Bill. Go ahead.
Okay, Brian, first of all, thanks for what you're doing. I know
Thank
you're working really hard and everybody else is. My question is, the patients that are in the hospital, are they being treated with these new drugs? They're not new drugs, the new old drugs that for the malaria drugs and all that. Have any of the local people been treated with any of those drugs?
I don't know that directly, Bill. That would be up to the hospitalist. So I haven't heard directly if they've been treated with the Plaquenil or any of the other drugs that are currently potentially being used for this.
Okay.
Hey, Brian, this is Chris with the Casper Star Tribune again.
Hi, Chris.
Another question. Can you, say, or do you feel that, we have the number of cases we have in Fremont County, the number of confirmed cases, I guess I should note, because of the disease is kind of spreading, i.e. community spread, or just because you've increased testing capacity?
That's a good question. I think with the delays, so again, the tests have been difficult because there's been such a delay in what we're actually potentially seeing. We don't have that instant 2-hour test or even 24-hour turnaround. I think based on the testing, based on some of the findings we're hearing from the different clinics around the county, there are people with symptoms consistent with this virus. And again, since there was a waning of the influenza virus, it seems like this is likely the most common thing going on in the county. I've spoken with some pediatricians who think there's another small virus through some of the kids, but it's sometimes hard to tell. So I think that we assume that it's out in the community now, and that's why we're asking folks to really practice good, social distancing, as well as self-isolation if they were asked to do so by a provider.
Thank you for that.
Yeah, you bet.
This is Eric Pauley from Wind River Radio in WYO Today.
Hello there.
Hi. A lot of the questions that we've received from concerned listeners and comments and things like that we've been asked has really led to what people have seen happen across the rest of the country in terms of talking about needing surge capacity, getting out in front of this thing for personal protective gear, things like that. What's the state of Fremont County in terms of surge capacity if this thing were to get worse than it is right now? And also, are we in dire need right now of personal protective equipment here in Fremont County?
I would say that not dire need, but I think that that's always a concern. So, that PPE, especially in the hospital or the clinics that have a higher volume, they are going through personal protective equipment pretty quickly. I think there's multiple things out there. People are looking at what other states are doing to try to, optimize PPE use. But I think just the sheer volume of patient care, especially for the hospital and some of the busier clinics, is forcing them to use their PPE relatively quickly. The supplies, I think, as reported to us today, were reasonable. But if there is a continued large number of patients that present to the hospital or the clinics, those supplies can dwindle, relatively quickly. With regards to your question about surge capacity, I think that the hospital has done a wonderful job of preparing. We've been in good conversations with them about how best, public health in general can help, and also what their plans are for increases in patients. And again, we have that surge of acutely ill patients, the ones that might require ER and maybe ICU or a little more intensive medical care. But then they're also going to have that long-term sort of care discussion as well. So I think the plans are in place. Discussions are made about staffing contingencies. So I think right now everybody's ready, ready as we can be right now, and are looking to the future for other ways to optimize that preparation.
Thank you.
You're welcome. Go ahead, Bill, if you can unmute.
Okay, Mike, you help me unmute?
You're ready to, you're ready.
You're good.
Okay, this is Bill Sniffin from Cowboy State Daily. I should say that. I have a question, and that is, how many hospital beds are there in Fremont County that are currently available? And what's the current census approximately in the hospitals now? For example, if there's 100 beds and we have 70 patients, does that mean we have 30 beds open? Or I'm just throwing that out to get some kind of idea of what kind of situation the medical community is in right now.
I can't give you the absolute numbers, Bill. I can say that in speaking with John Farrelly, the CEO, and their chief nursing officer, they are currently well-staffed. They have plenty of beds to accept patients that would have to come in and be admitted to the hospital.
Okay, also as a follow-up, how many ventilators do we have in Fremont County?
The numbers have been thrown around there. You know, there's between a dozen to a dozen and a half is what we've been told. Now, again, ventilators aren't necessarily the whole answer, right? We have to think about ventilators and staff and that as well. So there are ventilators. There's also some options for alternative ventilation that have been discussed as well. And so I think all those contingency plans are being explored by the hospital administration and physicians currently.
Thank you.
Yep, you bet.
This is Eric Pauly again from One River Radio Live today. I was going to hop in and ask another question here that, you know, we've seen reports of, you know, states having to compete with one another for buying masks, buying medical equipment and things like that on the open market, and the prices being raised. And what's Wyoming's experience been like that? Maybe not necessarily specific to Fremont County, but of course that's the supply chain that comes back to us. Is that something that we're experiencing at a state level?
I think that, as far as I can tell, I think there is people exploring all different options for personal protective equipment. That might be industrial personal protective equipment that's, you know, of the grade required in the hospital, and also all the channels within the county and state and federal levels to get that personal protective equipment. So I think it's ongoing, and in not only the preparation standpoint, but also as supplies get depleted, I think people are looking for all means to try to access that. So
Thank you.
you're welcome.
It's John from 88.1 again. If there's no more questions, Dr. G, could you just maybe give us a little summary of kind of how you started this off with again? Because I know you guys were looking for a better scope of what we've got. If you just want to give us a summary statement.
Do you mean, John, just a summary statement of what we've done in the last week or so, or the whole past 4 to 5 weeks that's kind of been up-ramped and
well, in yesterday's press release, you said you had been in conversation with a lot of people to get a better scope, and you would have those answers for us today.
and that goes with that would go with some of those numbers that we quoted, you know, trying to talk with the clinics more directly to get those day-to-day numbers. That has been helpful for us. It was a tabulation over the last 6 to 7 days of trying to get those numbers from the clinics, and now we're going to try to get a really firm day-to-day number if we can, to see if we can get those outpatient numbers, and hopefully we'll get more labs. Their lab capabilities might be improving over the next couple of weeks with improved delivery service, and the Wyoming State Department of Health are making their own media now, which is going to be helpful. So there's going to be some uptick in ability to do labs, which will help us. Again, they still will be limited though, so it won't be open to laboratory testing on everybody. So those are some of the big things that I think we can think about as far as numbers and data that can help us hopefully even get a better handle on what's going on in the county. So thank you. Are there any other questions?
I got one more, and this is Chris with the Star Tribune again.
Hi, Chris.
Do you know exactly or approximately how many, you know, tests are able to be done in the county on a daily basis at the moment?
Oh, let's see. I don't know if I have the actual number of tests. I would say, actually, I can't give you that exact answer. I don't think off the top of my head. So,
Changing.
yeah, I think Chris, it's going to improve with the Department of Health having an improving capacity, and then also the ability to send out media. And that's currently the big thing. I know LabCorp is also helping out with some of the private clinics. They have other systems in place, nasal swabs and nasal washings. So there's going to be some changes that are ongoing currently.
Thanks, Brian.
Yep, you bet.
I had one more question as well. This is Katie again. You had said discussions are ongoing about extra healthcare capacity in the future. Can you be at all more specific about what kind of options people are looking at or what that might look like?
We're looking at potential staffing options, how to kind of improve potential staffing options if required to help support the hospital and any other facility that might have to house these patients. I think Sage West is ongoing in doing that as well, just in preparations. And from a public health standpoint, we're reaching out to docs, nurses, respiratory therapists, other folks with any sort of medical background to see if they might be available in the future if necessary. Mostly as a contingency plan, obviously, but it's nice to connect everybody in the county in case they're needed.
Brian, Eric Pauly again. Something you said just triggered something for me. In terms of distance between two places in Wyoming is its own thing, right? With Fremont County and the expanses that we cover here, I mean, we've talked a lot about Riverton, talked a lot about Lander. What about are there plans in place for some of these outlying communities? I mean, such as Du Bois, who is, obviously very close to Teton County, as well as to the Lander Hospital, Riverton hospitals. What's the plan in place to direct people, inside of Fremont County in these outlying communities?
That's a great question, Eric. We're doing a daily 12:30 briefing with all the providers. So we're getting calls in from all different providers throughout the county, trying to see what they're experiencing. Obviously, we're trying to get numbers from those clinics as well and those communities. I think the current contingency is, Sage West in both Lander and Riverton are kind of the place most people come to. That's going to probably be the main place to direct them. The clinics out in Du Bois and in Riverton and Lander have been doing, the screening and healthcare provision for many of the other people. So that's sort of where we stand now as far as our current testing and follow-up in the county.
Appreciate it. Thank you.
Yeah, you bet.
Okay, Brian, I'm going to try it one more time. Can you hear me okay?
Yeah, you're doing great, Bill.
Okay, this is Bill. Do you have any kind of an estimate of how many people have been tested, but the results aren't in Fremont County? I mean, would it be 5 or would it be 20, or are we still waiting on results of quite a few?
So from the state webpage, now we don't have a good sense of what the LabCorp data is because that gets reported to the state, but it's not from the state lab, but the state will report a positive or a negative. From the state lab in the county, 78 have been resulted and 27 are pending.
John at 88.1, one last question. A listener texted in. Will we have drive-through testing centers? Is that something that is possible?
Well, we would love to have that, but the current state of testing would probably not allow us to do that. If down the road we get other capabilities like PCR type testing, that might be something. But I think in the near future, that's not going to be an option.
Hey, Dr. G, Amanda at County 10.
Amanda?
I sent over a huge list of questions from our community members, and Mike Jones let me know that you all will work on those and get back to us since it was quite long.
It was a huge list, yes.
Got a lot of questions out there, but in the meantime, I did get a few more here that reached out. I don't know if you can touch on those while we're on the line, but how many trained RNs and RTSs are there to handle the ventilators?
I do not know that number.
Awesome. I think that was the only new one that you haven't touched on. So thank you. And I look forward to having that list to share with the community.
Sounds great. And I would say before we close, I think we're working on trying to get an informational web page that folks can send questions in, and then we can answer on a more real-time basis, hopefully. So that's another thing we're hoping to get set up. So just to remind people to call the public health numbers if they've been asked to self-isolate by their providers. They've been listed before, and unfortunately I don't have those at the top of my head, but we're also going to try to have this web page that they could ask questions in real time too, and we'll try to answer them as best we can. So thanks for having me on and letting me chat with y'all, and keep up the good work.